Residents here in Western Mass got a chance to share their coronavirus concerns today with Congressman Neal and Dr. Mark Keroack, the CEO of Baystate Medical Center. The two opened the phone lines for people to call in. Western Mass News reporter Sarah Granelli joins us now live with more on what was on people's minds today. Sarah?
Beth, I was in that call today and there was a big range of questions, some asking if there is a vaccine for COVID-19, along with financial aid for families. There are still a lot of questions surrounding the outbreak of COVID-19 in Massachusetts. Congressman Neal and Dr. Mark Keroack, the CEO of Baystate Medical Center, opened their phone lines on Wednesday. Some people were concerned about how long the virus could remain on a surface.
It seems to last for several hours, but the concentration of virus declines fairly steadily. So while the virus does last on surfaces for a period of several hours, it's not clear how important that is in terms of transmission. Acquiring it through the spray of a cough or a sneeze or direct hand-to-hand contact with an infected individual who's touched their nose or mouth and then shakes your hand.
Others were concerned about a possible vaccine. Dr. Keroack tells Western Mass News that will take some time.
I do know that there are vaccine trials in their early stages, but those, to get a safe and effective vaccine is probably a year or more away.
Baystate Medical Center has been conducting COVID-19 tests, and callers were told that will expand in the coming days or weeks with mobile testing sites.
As soon as tests become available, we're going to be opening a number of drive-in centers in each of the regions that we serve, so people with mild symptoms can be tested.
But what about those who are forced to stay home because of their job has shut down? During the call, Congressman Neal addressed that.
The question we have before us on getting out cash support, which I think is something that's going to have to be done, is how difficult it is to put together what we would call a cutoff. And that's part of the discussion that we've had. So some of us have been of the position that trying to get the money to people who make under $50,000 a year would probably translate more quickly into economic support than anything else. However, there are others who legitimately think that we have to raise that.
Now, there are dozens of people in isolation at Baystate tonight, and a big concern is having safety supplies such as masks for the hospital personnel. Live in Springfield, Sarah Granelli, Western Mass News.